And Christina will be on stage. And this presentation, well, I know. And the next topic is about social protection, the World Social Protection Report. This is our latest report. This is where we have all of our key statistics, information. This is where we have a global perspective around the world. So Christina will take over this session, and she will give you all of the details that we know here at the ILO as part of our presentation. So Christina, back to you.
Yes, good morning everyone, and bonjour tout le monde. And good morning not only to you in the room, but also good morning to the world, because we're followed here. Given that we have a live stream, we have lots of people who are following the sessions from your countries, and I guess a couple of more countries all over the world. So think of it as really kind of a bigger and larger community. I'm now going to talk for the next 20 to 30 minutes. I think we'll probably have to speed up a bit on the World Social Protection Report. And Valérie has already shown you the video summarizing the results. I'm going to go into a little bit more depth. Certainly, I'm not going to provide you a complete picture, but I would like to invite you to really take a look at the full report, which is available on the internet site that Valérie has put up. It's social-protection.org, which is slightly different than the socialprotection.org website where the live stream is hosted on. And there you don't find only the actual full report with the full text, which includes a lot of statistical tables, but you will also have access to all the figures and all the figures also in Excel format. So whenever you do your own analysis or you have a presentation to do, you can also actually access the raw data and actually use them for your own purposes and for your work. So I would really like to warmly invite you to spend your night, or at least part of it, on reading some parts of the report. But I'm going to give you some taste of it in the presentation. No, just have to figure out how that works. Okay. This is an intelligence test, no?
You have to move it down.
Okay, not only me. No, okay. It has a bit of a... Okay. Merci. Okay, great. So the report gives you gives you really a global overview over the main trends. And as Valérie has just explained, we're looking at social protection systems as a whole. And we're using the terms either social protection systems or social security systems, because we know that the different elements of a social protection system, be it social insurance or be it social assistance, they need to work together. And they need to work together, making sure that no one is left without protection. And in that, we follow mostly a life course approach to look at different stages of the life course, and especially, but then obviously we look at income security, and we look at access to health in particular. So here you find a list of the kinds of benefits that we look into in particular terms, but also we are conscious that quite often countries have other types of benefits which are part of their social security or social protection systems. And we look at benefits in cash or in kind. So, both contributory benefits, that is social assistance, social insurance, and social assistance, and also universal schemes. And in most countries, actually, the protection, and we are aiming at achieving universal social protection very clearly, but in most countries, this is being achieved through a combination of different measures. It's through a combination of certain schemes which might be universal in themselves. So sometimes you have, for example, sometimes in some countries you have a national health service, for example, which covers the entirety of the population. Or in some countries you have universal old age pensions, which cover everyone above a certain age. Or in some countries you have universal child benefits. But then in other countries you have a combination of social insurance and social assistance. And it might also differ by depending on what part of the social protection system you look at, whether you look into health protection, whether you look into protection for children, for people of working age, or older persons. But we're looking at all of that, and the idea is really making sure that everyone is protected. And I think that doesn't necessarily mean that everyone receives a benefit at every point in time. No, what is important is that everyone is protected. So in case there's a need, in case you have a health issue, in case you're expecting a child in terms of, for maternity benefit, in case of unemployment, in case of old age, that you're sure that when you need it, you receive it. And I think this is really critical to making sure that everyone is being protected at every moment. It doesn't mean that everyone receives the benefit at every single point in time. And the report also provides new estimates on effective social protection coverage to monitor SDG target 1.3 that Valerie has already presented. And this is actually, and it makes, actually it's useful to actually read it through, because it's very much in the same spirit. The target, the SDG target 1.3, reads: implement nationally appropriate social protection systems and measures, including floors, and by 2030 achieve substantial coverage of the poor and vulnerable. So it's really about universal protection, but prioritizing certainly those who are most in need. And there's a specific indicator which you find here. I'm not going to read it out, but it looks at the population covered for the different parts of the social protection system, looking at children, looking at unemployed persons, older persons, persons with disabilities. Well, I'm reading it out. Pregnant women with newborns, work injury victims, and the poor and the vulnerable. And again, I think the issue of coverage is critical here. So what does coverage mean and how it's being measured? And actually we measure it by looking at those who are either receiving benefits at a certain point in time, and that's relatively easy to measure. You know how many people are receiving it. But then we also want to know who, apart from those who are currently receiving the benefits, who are protected. And for that we look mostly at those as a proxy measure. We look at those who are currently contributing to social insurance schemes for that particular risk or contingency, because the idea is really to know who is protected, not just who is receiving benefits at a certain point in time. So, I need to ask you a question, because we have prepared a couple of questions to wake you up and make sure that you're listening carefully. And maybe, Charles, if you could present the first question. So the first question is, and it's a multiple choice question: which proportion of the global population is not covered by social protection at all? So that means neither receives a benefit nor is protected, and is not covered for any of the different parts of the social protection system. So has really nothing at all. It's not just kind of partial coverage, but it's not being covered for any of the different branches. So just give you another couple of seconds, or is that already? I think you've been listening very carefully. Okay. But okay, so that was easy. let me just continue to ask you a more difficult question, because that you haven't heard yet. Which proportion of the population in Africa is not protected? If we can get to the next one. Okay. Okay. Still moving. I see you've already read the report, which is great. Okay, yeah. No, I mean, the majority is correct. It's actually 82%. And I mean, if we think about it, that 4 out of 5 persons is not protected at all. This is really a huge challenge that needs to be addressed. And we'll look into a bit more detail about how the figures look like also for other regions of the world. No. Okay, so here you have the figures. So 45% of the global population is covered in at least one area. It might be partial coverage, it might be kind of full coverage. The 55%, as you have very correctly noted, is not covered at all, which means 4 billion people. So this is 4 billion children, women, men, older persons, and this is really a huge challenge that we need to address. And I think this academy also will help us to address that. But we want to be a bit more ambitious. I mean, we don't want to look just at those who are to have a bit of protection. We want people to have comprehensive protection for all those areas. And if we look at that, the estimate is actually even more dramatic, in the sense that we are estimating that 29% of the global population has a more or less comprehensive coverage. But that means that 71% or 5.2 billion people are not or only partially covered. And again, I think the dimension and the magnitude of that challenge really gives us a lot to do actually for this academy, but also beyond. And if we look at it by region, we see huge differences by region. Obviously, the biggest challenge is for Africa, but also in other regions, we still see significant challenges. So we have a coverage rate, so this is not the other way around, it's those who are covered. Asia and Pacific, about 2 out of 5 persons are covered. That means 3 out of 5 are not covered. In the Americas, the situation looks much better, but we still have more than 30% of the population not covered. And even in Europe and Central Asia, where we have the best coverage, but almost 1 in 5 persons is not covered. So again, a huge challenge to be met. And this slide has already been shown by Valérie, just to say we have seen enormous progress in many countries. And the example of China here is particularly striking. But we know that there's still a lot to do. But we also know that it can be done. And I think this is really the most important message around it. So looking at social protection for children and families, and again, I would like to pose you a question and to see whether you have paid attention. Which proportion of children in the world are covered by child or family benefits? This one is a bit more difficult, no? Okay. It's interesting how these bars move actually. Okay. They're still moving. Okay, so between 35% and 28%, it's quite undecisive. So let's look at the actual figures. So it is actually slightly better than the 28%. Well, it's kind of 35% globally. But again, we see huge coverage gaps in many parts of the world. Especially again in Africa, where only 16% of children are covered. And although, I mean, we look here at mostly at cash benefits, which obviously, I mean, we need to also think about other types of benefits for children. But cash benefits are really important to contribute to income security of those very poor households. And quite often, also in many cases, the existing cash benefits for children are actually, for many poor families, it's really the only regular cash income that comes into the family. And whether it's the only one or whether it's just an addition, it is really a critical point, making sure that children actually can go to school. It also contributes to their access to healthcare. It obviously contributes a lot to nutrition. It reduces the risk of child labor and prevents child labor in some cases at least. And it is also a very important investment into children's future, and not only into the future of individual children, but really of the societies as a whole. Oops. I'm going to skip that one. And if we look at, because I mean, talking about investment, and this is very much also the way how many governments are currently looking into this issue, and we look into social protection as an investment into the future. But if we look at what is actually being invested in those programs for children, we see that there's a huge gap, especially in Africa, where the share of children in the total population is biggest. But actually the actual investment, the allocation of social expenditure to children is really minimal and does not match at all the number of children which are at risk. So this looks at the social protection expenditure for children, excluding health. But obviously investments in health are important, investments in education are important. So we need all three of them. And also we need also to look into issues, for example, childcare. We need to look at the services that come with it in order to have a full picture. But I think this graph shows a pretty dramatic picture to say, well, we need to invest more actually in the future of children. And we have a number of countries which have achieved universal social protection, at least at a basic level, for children, in different ways. Some countries use, as I mentioned before, use universal benefits. This was the case for Mongolia, actually. They've just recently changed course. Or it could be through a combination of different schemes and programs, as it's the case, for example, in Argentina. But at the same time, as Valerie has already mentioned, some countries are undergoing austerity and fiscal consolidation, which actually tries to reduce coverage and tries to limit the number of children receiving benefits. And this is very, very worrying. So we need to make sure that these investments actually continue, and that the protection is actually expanded. So let's look at the next stage in the life course, social protection for women and men in working age. And I'd like to pose you another of those questions and to see what is your guess when it comes to the coverage. And in this case, focusing on maternity benefits, looking at cash maternity benefits. Which proportion of women globally with newborn babies receive maternity benefits? What is your guess? Okay, so the majority of you have listened carefully to the video, and indeed it is 41%. And if we can go back to the presentation, I can show you the actual outline. And actually, I mean, I took the other percentages actually are for the different regions. Again, we see this huge diversity in regions. With the best coverage in Europe and Central Asia, but still with a significant gap, followed by the Americas, Asia and Pacific, and Africa again at around 16%. And obviously, this is really critical. I mean, when it comes to maternity, again, we're looking at a combination of different benefits. I mean, obviously, access to healthcare is important, and it's really critical, and there we see a lot of progress made in many countries. But then also income security, and as Valerie has mentioned previously, making sure that women giving birth, they don't necessarily have to be at work just the next day, just because they have to. Otherwise, they cannot put food on the table. Is really important. So at this very critical period in people's lives, making sure that they have income security that really allows them to take care of their health, take care of their children, and making sure also, and we know also that, I mean, having children for women also quite often means either dropping out of the labor market or finding themselves in informal employment. And making sure that people have income security during these critical phases of their lives is really essential. Also making sure that women are not forced in any kinds of jobs, but really make sure that not only their lives are protected, but also their income generating opportunities, their jobs are protected, that you have proper protection when it comes to maternity leave, but this applies mostly to those who are in the formal economy, but we also need to look at those in the informal economy, ensuring that with the proper protection, their working conditions and their employment can be protected. And we see progress in many countries. I mean, we see progress in countries like Argentina, Mongolia, also South Africa is important to also extend coverage to women who were previously in the informal economy. For example, in South Africa, a couple of years ago, the coverage was extended to domestic workers, and that made a huge difference for domestic workers and actually brought them from the informal economy into the formal economy. So it's also about transforming their ways, providing better rights, and helping them to move towards the formal economy. But still, obviously, we have huge coverage gaps. And we need to talk about fathers as well, because this is not just about mothers, but we see also progress when it comes to paternity leave, because we also need to make sure that caring for children is not just the business of the mother, but that also fathers take up their fair share in that. So I need to speed up a bit. I'm looking at the watch. So when it comes to unemployment, there again we see huge gaps in coverage. But at the same time, we also see some positive trends. For example, an expansion in unemployment protection in various middle and low-income countries such as Cabo Verde and Vietnam, for example. And unemployment benefits are also very important to support structural change in the economy. And we know that our economies are changing, the labor markets are changing, making sure that people have income security when they lose a job and transition into the next job. It can also really help protect people from slipping into the informal economy whenever they lose jobs, and making sure that they can actually afford to look for a job which matches their skills and experience. And this is not just good for the individuals themselves, it's also good for employers, because they will find people who are actually matching and have a good experience, and it's good for the economy as a whole. And then the same for employment injury protection, which is also one of the critical elements of social protection systems. Again, here we see extreme and huge coverage gaps for a majority of workers, especially in many developing countries. But again, we see progress in many countries. Also, a number of countries are moving from employer liability systems into social insurance, which is more equitable and more sustainable. When we look at persons with disabilities, again, the large majority of persons with disabilities in the world are not protected, and so this is again a huge challenge. Also, because in many countries, the existing schemes they're based on insurance, which quite often excludes people who haven't really, either are not part of the labor market, have not worked, at least not in formal employment, and or have not acquired sufficient experience and don't yet meet the criteria. So again, looking into non-contributory benefits to complement the existing schemes, to make sure that those who are not covered by the social insurance have at least a basic level of protection, it's really critical. I'm skipping a bit over some slides because we don't have enough time, but you're going to receive the presentation and can actually read it through, and obviously also you have the full report. And by the way, the report is also available in French and in Spanish, and it will soon also be available. No, I think it is already in Portuguese for those who want to read it in other languages, and in Chinese as well. So for old age pensions, this is actually the area where we have seen most progress in terms of extension of coverage. And especially the fact that many countries have implemented non-contributory programs to complement the existing social insurance programs. This has helped a lot when it comes to the extension of coverage, so many more people are now covered. But one remaining challenge is making sure that the benefit levels are adequate, because this is really one big challenge. And actually for old age pensions, and I have to say this is one of the few areas where we actually have separate data for men and women for a larger number of countries. We see that there's still a lot of gaps in many countries. For example, here, if you look at Mexico or Jordan, for example, where you have a lot of important differences for men and women, where women are not as well protected, and which partly reflect, or to a large extent actually reflects inequalities in the labor market. So where women are less likely to work at all, or to work in the formal employment, and then you have very persistent wage gaps, you have kind of occupational segregation, etc., etc. So what you see here is not so much in kind of the different rules for men and women in the pension system itself. It's a reflection of the inequalities that exist in the labor market. But nonetheless, this is something really which needs to be addressed. And as I said, the non-contributory schemes have made a huge difference. And actually, you see the number of countries here with 100% of coverage. These are those who have actually the universal systems. But this is not enough because the non-contributory, the tax-financed pensions, they normally provide a very basic level of benefits, quite modest. But if we want to achieve gender equality, we also need to look into gender equality in the contributory systems. And this is really one of the challenges in the future, because this is really the combination of both is actually what gives people an adequate level of income during old age. So I'm sorry, I'm going back. I'm skipping that, because looking at, we still have a lot of program for this session. For health coverage, again, an important point, and I will not be able to do it justice to that important topic. I just want to highlight one important issue here, which we haven't addressed so much for the other areas, and this is the issue of inequalities between urban and rural areas. And this is a huge issue. I mean, globally, what we estimate is that about 22% of the urban population does not have access to health coverage, at least at a very kind of basic level. But it's true for 56% of the rural population. And again, this really calls for decisive action to make sure that these coverage gaps are being eliminated in fact. And actually, one of the reasons is a global shortfall of health workers, but you also have enormous challenges when it comes to the financing, when it comes to quality, when it comes to geographical access, actually staffing and providing the services. Also, there's a huge issue when it comes to infrastructure. But there's also an issue when it comes to, and it's embedded also in a broader issue, to look what are the working conditions, for example, for health workers. How do the wages look like? And there it's again a question also in many cases, governments try to save, and in their kind of fiscal consolidation policies, and very much this affects also this critical sector very negatively. And again, just to close, I'm going to skip over a number of slides to just kind of move to the end. I think one of the critical challenges, and we have also heard that in already several times this morning, is really extending coverage to those in the informal and rural economy, and making sure that we adapt the social protection systems in a way that can actually cover those groups of the population. Making sure that they are actually covered by the social protection floors, which provide at least a basic level of protection, but not end there, but also look be more ambitious and look at higher levels of protection and be transformative, in the sense also to use social protection policies also to facilitate the transition to the formal economy for those groups of the population. And I'm showing here one example. This is data from Uruguay. Uruguay, they have implemented a mechanism. It's a simplified tax and contribution payment mechanisms for self-employed and micro enterprises. And with that, they have actually managed to increase coverage enormously among those groups. So this was really a very concerted effort to move forward in that respect, and it has shown its results. And what is quite interesting now, also we talk about the future of work, and we talk about the different challenges when it comes to the digital economy, for example, when it comes to the new forms of employment. Uruguay is now using the same mechanisms to cover, for example, Uber drivers and drivers in other forms of these digital services because they have made it a condition. They have made it a condition for the operations of companies like Uber in Uruguay to say, well, I mean, yes, you can operate in our country, but we want you to cover the drivers. And they have created a specific application so that it's easy, so that everyone can easily do that. And I think this is really a very interesting example to show that these mechanisms really are not just for the kind of traditional forms of informal employment, but they can also help with the new forms of informal employment that we see in the new economy. And one final slide, and I'm going to stop here. But just, we have a number of challenges. I mean, extending coverage to the informal economy is one of them, but we need to work more on making sure that social protection systems are really fully inclusive of everyone. For example, ensuring the inclusion of persons with disabilities, indigenous peoples, persons living with HIV/AIDS, etc., etc. Migrant workers is a huge issue, and you're going to hear also a bit more about that. Social protection systems in crisis and fragile contexts. What are the kind of the mechanisms that can work in those contexts? Tackling demographic change. And demographic change is not just an issue for countries in Europe, which are already quite old, but tackling demographic change is also an issue for the very rapidly aging countries in Asia and in Africa. Although the absolute levels are still low, but the speed of change is much quicker than in Europe. And Valeria has already mentioned climate change, using social protection to facilitate adaptation to climate change and the future of work. And I'm ending here and hand over back to Jean. Thank you very much.
Don't go anywhere. You have some questions. Okay. All right. Thank you very much, Christina. We're running late a little bit, but nevertheless, I think I want to take this opportunity to make sure that we could answer some of your questions. So we're going to do the same trick that what we just did a bit earlier. So you'll be invited to ask your question using the iPad. And Christina will be invited to react to your different comments, feedback, and also questions.
Okay. So I'm starting, and I see you put on very challenging questions. Do we see an increased trend in informal employment compared to formal employment? It depends where you're looking at. In some countries, we see a decrease, but in many countries, worryingly, we see an increase, actually, in informal employment. It's not always called like that, but you see more precarious forms of employment. And this constitutes a huge challenge for many countries. A lot of it is also what I have just explained. There are the kind of the traditional forms of informality and the new forms of informality associated with the future of work. Working on, for platform workers in the gig economy, for Uber drivers, for example, etc. And one of the challenges is really to make sure that all forms of work are adequately protected. And what is heartening to see, and we have a huge challenge, especially when it comes to self-employed workers, to some extent also for temporary workers, for part-time workers. But the self-employment is actually the biggest challenge if you look into the numbers. And a lot of countries are moving forward to improve protection for the self-employed, because one of the issues, and I think this is also one of the reasons why we see quite often an informalization, is that at the moment we have quite often, given that self-employed workers are not covered, we see a huge kind of gap, and this is also a gap when it comes to looking at the cost of employment, which provides an incentive for employers actually to use the cheaper forms of employment and use, rather than using employees, outsource and use people in self-employment to do jobs as a kind of a strategy to cut costs and to reduce the cost. And so we need to improve protections for those who are in self-employment. And this is obviously not easy. You cannot just use the same mechanisms necessarily, but you need to adapt. I mean, as I showed the example of Uruguay, what they have done is they have put in place simplified mechanisms for those who are, and to a large extent, this is people in self-employment or in micro-enterprises. So they have simplified basically the access to the social protection system. So everyone is covered under the same scheme. It's not that you have separate schemes for employees and the self-employed. They have one scheme, but they have opened another entry door for the self-employed, and an entry door which is adapted to their needs. And I think this is really critical, making sure that we find ways of adapting the system, making sure that the forms of protection actually work for everyone. And it means that we need sometimes some of the procedures need to be changed, sometimes the offer of benefits needs to be changed, and quite often it also means that the government needs to step in to subsidize those on very low incomes. But it is possible, both for the traditional forms of the informal employment, but also for the kind of the new forms of informal employment. And there has been also a lot of countries have now committed to ensuring protection for workers in all kinds of employment. The G20 has just come out with a declaration to that effect. The European Union this is one part of the European pillar of social rights, which was adopted almost a year ago. So I think there is some movement really into that direction, making sure that social protection covers workers in all forms of employment. But as I said, we need to make sure that this is done in an adapted way. Oh, sorry, I've been talking too long on this one. Okay, so that's on the third. So should the term retirement be redefined? And so people are living longer, indeed, and the existing social protection is not enough and sustained to protect them. I think there are different dimensions to it. I mean, one of it is really looking at the actual retirement ages or pensionable ages. So basically the question kind of what is kind of the age that people start receiving a pension. And indeed, in many countries, there have been some moves to increase retirement ages or increase pensionable ages. Quite often with a lot of resistance, because many people are feeling that they're not ready, and that the increase in retirement ages doesn't really reflect the needs of many people, especially as many people work in hazardous occupation. In many countries, there is quite a high level of unemployment among older workers. There's sometimes discrimination of older workers. So the question is how to find a way to adapt the pensionable ages in a way that really meets people's needs. But it's true that as we live longer, some people are able to work longer, and I mean, obviously, those people shouldn't be prevented from doing so. But it's important also to make sure that those who actually need a pension will have access to a pension in that respect. But I think that probably kind of warrants another discussion in another context and maybe in another course. And I'll hand back to Charles.
Okay, thank you very much, Christina. That's it.